focus tonight is fact or fiction, right now as it relates to pregnancy. Now, women have babies every day, but as common as pregnancy is, there's still a ton of confusion out there. For instance, I'm always asked, or often asked anyway, can you get pregnant while breastfeeding? Does your sexual position make a difference? And is sex during pregnancy dangerous? Here with some answers is fertility specialist and OBGYN, Dr. Lisa Masterson. Lisa, thank you for joining us.
Oh, thank you.
So, what are the wildest questions that expecting parents ask you about sex during pregnancy?
The men often wonder whether or not during intercourse, are they going to hurt the baby? Can they have intercourse? These are the type of questions I get. Can you get pregnant during breastfeeding?
Well, let me stop you with the during pregnancy sex, because I get those too. And am I going to hurt the baby's head? Is the baby going to see it?
Absolutely. And no, you can have sex during pregnancy as long as your doctor has said no because of preterm labor or bleeding or things like that. It is not going to hurt the baby. Baby has no idea what's going on other than a little bit extra shaking it up a little bit.
So a normal pregnancy without any complication, you can have sex right up to the day of delivery.
Absolutely. And what a lot of people don't know is actually around 36 or 37 weeks you want to have intercourse because the prostaglandins can help labor occur. So it actually helps.
Now, I better put that in English language for people. That there's chemicals released that during sexual activity that induce labor and bring things along.
Right. So the semen that's in, that surrounds the sperm, that actually has those chemicals, and those can cause the uterus to contract and cause labor to come on.
Interesting. Now, I always thought one of the great tricks that God played on humanity is that women feel more sexual aroused oftentimes in the third trimester. Is that true, or why does that happen?
It can go either way. Some women will feel more sexual aroused because of the lubrication and the hormone levels.
The progesterone is very high.
Absolutely. But
congestion
some women,
in that area, they swell.
They swell. Some women will actually, because of their self-image, of feeling larger, their libido will actually, their sexual desire will actually decrease. So it's very individual.
But regardless of the level of arousal, they can still go ahead, provided no bleeding, no preterm labor, and no doctor saying no.
Absolutely.
Can you get pregnant while breastfeeding?
Absolutely. And so that's one reason why at 6 weeks we make sure we go over contraception with women, because they don't know they can actually get pregnant while breastfeeding.
Is a decreased risk of pregnancy, though, with breastfeeding, is there not?
Absolutely decreased, but there is still a risk.
You still can. So we've actually got a few pregnant women in the audience with questions for us.
Great.
This should be very interesting. Wendy, where are you?
I'm right here.
Wendy, what do you want to ask us?
So I want to know, does having an orgasm actually induce labor?
It can, but it doesn't have to. Orgasm can cause uterine contractions, but labor is repetitive uterine contractions. So even though you may have one uterine contraction, it doesn't necessarily put you into labor.
Now, women also ask about masturbation and vibrators, that sort of thing. Any guidelines?
Masturbation is fine because, again, orgasm does not necessarily trigger labor, even though it can cause contractions. Vibrators are not good because they're putting a foreign body into the vagina, increase your risk of bladder infections and vaginal infections. So you should stay away from that.
Very good. I had not heard that. And we have Dana.
My question is, does a certain sexual position determine gender?
No, position does not determine gender.
Where'd you hear that?
Internet, myths.
What did you think?
It's crazy.
What position did you think would do what?
Like if you're on top, you're going to have a girl, or... It's probably crazy,
You
right?
can see there's no science to that at all. Yeah, just myths.
Jody?
Okay, well, mine is, I had Gardnerella with my honey, and we went through the whole antibiotics and cleared it up. So now are we out of luck? Because if we don't have sex again, we probably won't get it again. But if we have sex, we'll probably get it again? Or
hold on
is it
now.
gone?
You're how far along are you?
5.5 months.
Is there certain times during the pregnancy that the vaginal infections are riskier?
No, you can have them all throughout the pregnancy, but once they're cleared, and you shouldn't necessarily get it again. So the idea is you treat yourself. It doesn't mean you have to refrain from intercourse for the entire pregnancy, but again, if it comes up, then we'll check you again.
He was treated also.
He was treated
so
also.
they're both treated.
Right.
Tree.
I've heard that vigorous sex or different positions can hurt the baby, so I was just wondering about that.
You can't hurt the baby with intercourse. Baby is surrounded by the uterus, which is a muscle. It's a very strong muscle. So it really cannot feel the penis. It's not getting anywhere near that. You are absolutely not gonna hurt baby with intercourse.
What are you guys doing?
That's for us to know.
Can you get pregnant without vaginal penetration?
Yes, absolutely.
happen.
Because remember again, those
Sperm
guys
swim.
can swim.
They stick and they swim.
And they stick
We've
and swim. They
established
do that
tonight.
very well.
So it's not a myth that you could get. Can it get through clothing?
It's going to be more difficult.
Very rare,
Yeah.
right? Almost impossible. And thank you, Lisa, for joining us. Always a pleasure.